Over the course of thousands of years, humans have changed physiologically and cognitively to increase our ecological fitness. While many of the traits developed in the earlier stages of human evolution continue to aid in our survival, some of these heuristics have become, not outdated, but somewhat ineffective in the context of contemporary social structures. The first anatomically modern human is theorized to have developed approximately 300,000 years ago. At that point, the human brain had cranial structures were equipped with an enlarged prefrontal cortex, which is one of the key components to engaging in complex social interactions, multi-stage decision-making, and the development of language. Language in particular was, and is, imperative in the development and maintenance of civilizations as we transitioned away from hunting or gathering and towards agriculture. Interacting with other humans greatly increased our chances for survival. However, modern language took several centuries to develop, so in order to maintain a higher chance of surviving, humans developed heuristics. Heuristics acted as cognitive shortcuts with the broad goal of making quicker decisions, often at the cost of the quality of those decisions. In a specific example, the anchoring heuristic describes the tendency to fixate on the first piece of information presented as the precedent for all knowledge concerning a given topic. Historically, this heuristic helped early humans to establish a consistent pattern of behavior, and in turn consistently fit into the environment. Likewise, this heuristic is self-perpetuating, meaning with each successive generation of humans, parents taught their children behavior to avoid predators and effectively cultivate food. The incoming generation fixated on that knowledge and then passed it down in a cycle that would allow humans as a globe-faring species to flourish. However, as humans organized into more and more complex social structures, the anchoring effect and similar heuristics contributed more to the development of interpersonal conflict and fixed mindsets within regional environments, instead of then increasing survivability across the species. Rather than anchoring to traditions passed down to ensure longevity, incoming generations of modern humans anchored to political ideologies, systems of moral beliefs, personal experiences and other preconceptions that in the worst cases bred prejudice and miscommunication. In a case study concerning medical bias, a sample of 423 physicians, nurses, medical students, and nursing students were tasked with assessing the pain of 16 fictionalized patients that were experiencing headaches. When given the opportunity to make their own judgment, before reading the patient's self-assessment, participants routinely anchored to their initial impressions. In real scenarios, this can influence how patients receive treatment, and the effectiveness of these treatments. In conclusion, anchoring and similar heuristics have been historically important in the development of human civilization, but past a point in that evolution humans had influenced their environment enough to ensure their survival, which made most heuristics increasingly less applicable. Instead, humans now have the social space to think more elaborately about their decisions and the resulting consequences.